sit closer to the desk?
Thanks for tuning in for our 18th live stream. In celebration of Women's History Month, we thought it would be perfect to dedicate this episode to discussing some of the Lyme disease issues and challenges that are particularly unique to women. So for those of you who don't know me, my name is Julsey Capon. I'm a Lyme literate psychotherapist, and I mainly work with children, adolescents, and young adults, helping them cope with the social and emotional impact of Lyme disease. Thank you so much for these awesome questions. Me and Dr. J are super excited about today's episode. We think it might be the best one yet, so we're just thrilled to be here today. And please, as this live stream goes on, post questions on the comment section on Facebook, on Jemsek's Facebook page, and I'll be reading through them, and if any of them are relevant, we'll be happy to answer them along the way. Before we get started, let's introduce the very famous and world-renowned Lyme literate doctor, Dr. Jemsek.
Hello, everyone. It's such a pleasure to see you, and I'm delighted to be working with Julsey again for the 9th or 10th time. 18 live streams in 24 months, not bad. 18 hours. I hope to do them regularly in the future and continue with our education. In fact, I have a little mantra to present in a moment, and about the purpose of why we do this, and to try to crystallize what it means to us and hopefully to you. And I'm fond of doing quotes, and I love quotes from Churchill and from Dr. Osler and so forth. So my thought today to you is, I hope and pray that JSC live streams and other efforts prove to be a valuable service to all, particularly those who cannot access medical care. Education, demystification, and validation for what you're going through and how we can help you. Validation that you are having an illness and there is help, even if you can't access medical care. Choose life over Lyme. So today's topic is very broad. It's Women's History Month. We had Women's International Day. When I grew up, it was kind of like every month was Women's History Month, and every month was Women's Month for sure. So I, celebrate that every day. Women are my favorite gender, by the way. There's no question. So just to make that clear. So going forward, I'm going to list some conditions that we can talk about another time because they're a little more complex. We are going to get into complex issues today with some of the questions. The questions were fantastic. Mm-hmm. And, I think it's so relevant and so important. But here are some conditions that are women-specific or women-dominant. And we can start with interstitial cystitis and the trouble that people have with that. We see it both in men and women, but women predominate 5 or 10 to 1. Another condition would be a PCOS, polycystic ovary syndrome, which can complicate LBC tremendously. We think Bartonella is the culprit with this. When you see cysts all over the body, in the ovary, in the breast, in the pancreas, in the kidney, in the liver, in the lungs, even in the brain, Bartonella is making little cystic webs. You can count on that. We make that association. Pelvic floor dysfunction is not unique to women, but more common in women, and is horrifying. It's a contraction, inappropriate contraction or relaxation of the pelvic floor muscles due to irritability of the sacral plexus, particularly the pudendal nerve, which innervates the urogenital areas in our body, and also the support muscles. So it can be terrifying. Vulvodynia, having to do with sensory sensitization in the female genitalia. Touch and obviously intercourse is uncomfortable, very uncomfortable. So obviously that has an effect on the relationships between a male and a female, tremendously so. And then finally, the most practical one, and we'll talk about this a little more, is premenstrual volatility. And, or it also goes by MDD, which is premenstrual dysphoric disorder. Very common, and This is something that we pay attention to very carefully at JSC in our history with premenopausal women, because it can be violent and it can last several days. And it's very hard to treat someone where 7 out of 28 days or even more days out of the 28-day cycle are occupied by a patient being terrorized because their inflammatory index has spiked due to their hormonal imbalance. So I'm going to turn it back over to Jules. I hope you appreciate the new mantra, which is education, demystification, and validation. And of course, our mantra, choose life over Lyme, has been there for a while. And by the way, just so you know, and this is a little off topic, but one thing that you can do, and it's in our self-help book, to sort of cleanse the brain, is change the signaling in the prefrontal cortex from the lateral cortex to the medial cortex, the prefrontal cortex. You can do that by taking warm showers or any other activity with tactile sensation that promotes looking inside rather than outside and promotes creativity, increase in dopamine. And so shower thoughts are a real thing. Look it up. Shower thoughts are important, and that's one way you can look inward. And most of the thoughts inward, I think, would be good. It's your creative self. There's something about having the tactile pleasure or the sensation of warm water that distracts you and allows your brain to float. And it's happened to me. In fact, that's how I came up with Choose Life Over Lyme. That happened in my shower 3 or 4 years ago. So that's a little inside personal note, but it's a real thing. Look it up. Thank you.
All right, let's get started. Our first question is, how does Lyme affect a woman's hormones?
Every which way but loose. So we have everything from amenorrhea to dysmenorrhea to frequent cycles and so forth. We don't administer female hormones, but we do recommend seeing the GYN to help us with the hormonal issues. We do measure them, especially testosterone. So all of our hormone loops are consist of a signaling hormone, which comes from the pituitary and indirectly from the hypothalamus. The pituitary has 2 sections, the posterior and anterior. There are 2 hormones in the posterior pituitary and 7 hormones in the anterior pituitary, including LH, luteinizing hormone, and FSH, follicular stimulating hormone. If these hormones are not released because the pituitary is damaged, and that happens infrequently, hypothalamus and pituitary are small structures, very vascular, and commonly infected. So obviously we're checking these hormones. So if they're affected in the end organ, the ovary in this case, doesn't get the signaling, then you're not going to ovulate, you're not going to release hormones, and you're not going to have any semblance of a normal cycle, to the point that you may not have a cycle. Oxytocin can be suppressed as well, and that takes away a pleasure sensation with hugging and other activities. And so that it definitely is damaged. So we'll talk about this a little bit later. It's very complex, except to say that testosterone is extraordinarily important too, and it's converted by aromatase in biochemical changes in the body, and testosterone is vital for women's health as well. So we definitely measure that, and we do encourage replacement of testosterone when it's appropriate.
It seems like Lyme is more prevalent in women than men. Is this true? So I don't think Lyme is more prevalent in women, but I do think women tend to seek out medical care more often, and mental health care for that matter. For example, 75% of my patients are female, and that's not because men aren't struggling. It comes down to the stigma, the social stigma and the self-stigma. The social stigma being the public or society's perception, and the self-stigma being your own thoughts and judgments about yourself. So the masculine norms of men have to be strong and self-reliant, can't ask for help, men have to be slow to show emotion and vulnerability, are huge barriers to them seeking medical care. It's very underutilized, even though treatments, mental health and medical health care are widely available for them. I also think women are more vocal and open about their medical and mental health struggles. They tend to post more on social media, whether that's for educational or advocacy purposes. They write books and blogs and start fundraisers. create nonprofits. Not saying men aren't engaged in these activities as well, but they are typically women-run and driven. Dr. J, what percentage of your patients would you say are women here at the clinic?
I would say 65%. That's definitely 65%, maybe a little bit more.
And do you think that's because Lyme is more common in women, or
No,
what I was referring to, they seek out medical care more?
I don't. Men can get just as sick, and but I do think there are some long-held social barriers for men seeking help. And but I actually think we're seeing more men in the process. And but yeah, the ratio is 2 to 1.
Men, don't be afraid to ask for help. Seek it out. Doesn't make you any less of a man.
That's true. No, it doesn't.
All right, moving on. Next question. Can a woman pass Lyme onto their child in utero, and what is the likelihood of that happening?
All right, so I'm going to be a little bit controversial. Not going to talk about COVID or Biden, but I'm just kidding. But yeah, I think this is, well, first of all, it's not been studied. So the CDC has ignored this. I'm afraid the testing would not be good. There are other barriers, but I'm just afraid they don't want the answer. They don't want the answer, and the same thing can apply to sexual transference. They don't want the answer. There's been a scant report here and there about the 𝗧𝗜𝗠𝗘𝗦𝗧𝗔𝗠𝗣 or in pelvic secretions or what have you. Nobody wants to study this because they're afraid of the answer. The answer is, yeah, the 𝗧𝗧𝗏 can go back and forth and vertically mother the child. I think it's 100%. The 𝗧𝗏 can do what it wants. It can go where it wants. It's a very complex, versatile organism with many life forms, as most of you know. And I think the fetus is definitely infected a majority of the time. I think it's grossly underappreciated. Does that mean the fetus is going to develop advanced Lyme disease in an early infancy stage? No. Maybe we can talk about some of the nuances of that later. And certainly we're going to talk about what we do for our pregnant ladies who want to protect their fetus and we want to protect them.
So what is your typical treatment protocol for a pregnant woman?
Well, what I've done for quite a long time is I touched base with some academic OB-GYNs, and I looked at my experience in infectious diseases. And now you understand with pregnancy, nobody's going to do a double-blind trial because the liability would simply be too great. You also realize that part of medicine is based on centuries of experience, and that's where we get our alternative therapies and Chinese medicine, that sort of thing. So that counts for something. Medical science changes every 20 years. It does a 50% change, and the problem is we don't know which one is right, do we? So it's constantly changing. And, if physicians would just understand that and be a little more humble about the fact that, everything needs to be looked at, science needs to be applied, but you have to have the right hypothesis. And if you don't have the right hypothetical construct, what you're going to do is worthless. It's going to fail from the beginning. It's doomed to fail. So, so I think that all these things factor in, and so pregnancy, hasn't been tested or studied. And we'll talk about our prophylactic program in just a moment.
And what are your thoughts on if you can pass Lyme through breast milk?
No studies. Possibly, but no studies. It's never been confirmed. For our ladies, we're going to continue the same program I'll talk about in a minute. Most women want to breastfeed for, I'm told, the healthiest thing for 6 to 12 months. And we're fine with that. Sometimes the postpartum period can be rough because of the hormone drop. Estrogen is a protective hormone and anti-inflammatory hormone, I should say. So most ladies through pregnancy, everything else equal, will feel better during pregnancy. I've had ladies say, I need to get pregnant constantly because that's the only time I feel good. This is a true story. Yeah.
I felt better than I ever have when I was pregnant. And I'm currently breastfeeding. I'm 7 months postpartum, and I've been breastfeeding this whole time. And you guys have me on a very safe protocol, azithromycin and amoxicillin, which are pregnancy safe too.
Shall we talk about that now?
The pregnancy protocol?
Yeah, our incident.
Yeah.
Might as well.
Yeah, go ahead.
Yeah, so back in the day, I would use, I would be afraid of the first trimester, but I knew that amoxicillin and some of the cephalosporins were safe. And this is just by acquiescence. We just don't have any adverse effects. We're afraid of quinolones, and sulfa, and a lot of other medications. And OBs are very sensitive, as they should be, to make sure that the patient is taking minimal therapy, which can be very, very complicating for a very sick patient who happens to become pregnant. But we devised a program that's pretty simple. We use amoxicillin or another cell wall antibiotic, such as the cephalosporins, so things like 𝗧𝗜𝗓𝗏 or 𝗧𝗜𝗑𝗦𝗧𝗏 seem to be well tolerated and safe. So we use those twice a day, Monday through Friday during the pregnancy, and Zithromax 500 milligrams once a day. Sometimes people can't take one or the other. So a few years ago, I talked to an OB academic at Georgetown who said, no, you go ahead and start as soon as they conceive. So now the recommendation is that, okay, as soon as you know you conceive, we're going to put you on these medications. The OB is on board, and 99% are on board, OB, because, they know it's safe, and they also don't want to have any liability. What happened if they fail to do it and the baby has birth defects, which do happen, contrary to what's in the literature. So we do that. We've done it with well over 200 ladies over the years. Unfortunately, I don't have the research people collect all the science. Our program is to treat them, maybe see them once during the pregnancy, and provide them with a kit to do an analysis, a PCR analysis of the cord blood, looking for beryllium, and then sending it off and having the OB sign our pre-printed form, because you never know which OB is going to show up in L&D. And it's worked out pretty well. I would say 80% of our ladies got the blood work done, and I would say 95% of the ladies did the program. And so let's say there were 200 ladies that sent in blood work, and we have 4 positive PCRs from blood work. And those infants, to my knowledge, have not been highly impacted by the illness. So we had 4 out of 200. Does that mean the other 196 are Borrelia free? No, of course not. But at least they're not infested with the spirochete. And I do have a couple instances of which are well reported of fetal abnormalities in ladies who were very ill, and it's amazing how they got pregnant in the first place. We're going to talk about miscarriages and miscarriage rates briefly in a moment. But they had fetal deformities. Children got through it, but it was the NICU and premature delivery and all kinds of medical complications, just a nightmare. So, but for the vast majority of ladies, they do fine.
And a question I get asked a lot is there an ideal time to get pregnant? Do you recommend them being in remission for a certain amount of years before trying to conceive?
I do. We'd like patients in remission for 2 years, but if a 37-year-old lady is a female patient is saying, I don't have much time, the clock is ticking, that old adage. And they've just gotten through therapy. Really, the healing begins in earnest at that point, and it takes 2 to 5 years to heal. The sicker you are, the longer it takes to heal. And we've seen miracles at year 2 of healing, 2 or 3. People start to turn around. You have to know these things. You can't know this unless you spend time with our patients and you see it. Now, I have to share with you something that I think is so sweet and so much fun, and we have fun with it. But I'm often asked. I've been asked many times when the husband in the room, well, doctor, can I have a baby? And I sit there like Solomon. It's like, okay, I'm not God here. It's not God. But they're so sweet, and they're so earnest, and we have a trust, and they want to know, and so I have fun with it because because it's a little bit awkward for me. but with a straight face I say, yes, you may. But if it's a male child, it should be named Joseph, and if it's a female child, it should be named Josephine. And by golly, one of my patients named her girl Josephine. So, but we have fun with it. And, I'm very encouraging to the patients. Of course, we feel like they're protected. But ideally, we'd like at least a year remission so there's more healing, and 2 years would be the best.
I think I asked Dr. J several times, when can I have a baby? I begged him to be like, anytime. And he gave me the same answer, 1 to 2 years. Wait 1 to 2 years till you're in remission. Wasn't the case for me. I had a little whoops. I was actually very sick when I conceived. I was super scared to call Dr. J and tell him.
Yeah.
He was really nice about it and supportive. But just...
Your mom was pissed.
My mom was very mad. But to put your mind at ease, if you conceive and you are not at that 1 to 2 year remission mark, that doesn't mean you're going to have an awful pregnancy. That doesn't mean you're going to be sick the whole time. I was very healthy. As I just said, I probably felt the best I had in years. And they put you on a pregnancy safe protocol. I'm doing great now. My baby's healthy. So accidents happen. It'll be okay.
Couldn't happen to a nicer person.
All right, moving on from the pregnancy topic. What are the main psychosocial impacts of Lyme that women most commonly face? So hands down, isolation. We talked about this last live stream with the children and adolescents and the social isolation that they endure because of Lyme. And it's very similar for adult women. Same pattern. They get sick. Their friends at first are still supportive. They're making an effort, but the sick person constantly has to say, no, I can't hang out. I'm not feeling well. They get tired of saying no, and their friends get tired of hearing no. So naturally, they drift apart. And I'm also realizing people are uncomfortable with chronic illness. They don't know how to act around you. They don't know the right questions to ask. So they end up, resorting to the classic, how are you feeling? How's treatment? And you can answer one of two ways. You can be honest, be like, yeah, I feel terrible, but then no one wants to be that constant Debbie Downer and bring the mood down. So you could lie and say, yeah, I'm feeling okay, hanging in there. But then that gives the impression that you are doing okay. And then that person thinks, well, if you're doing okay, why aren't you working? Why aren't you out and about? Why aren't you leaving your house? So sometimes it's just easier to avoid those social interactions altogether, but then that further leads to isolation. So that isolation, biggest psychosocial impact that I see. Another one is the classic medical trauma that women endure from being told over and over again by the medical community that our symptoms are all in our head, or that we're told, well, you look great. I remember one doctor's appointment I had, I think I couldn't even walk at this point. He was like, well, you're pretty and thin, so how bad can life be? And that was devastating to me because what I was hearing, how I interpreted that was, you're not worthy of a proper evaluation. You're not worthy of proper medical care because you look a certain way. And what does that do to your self-worth and self-esteem? If a doctor's not valuing my well-being, how is my family and friends supposed to, or how am I supposed to value myself? And then that makes us feel like we constantly have to defend our symptoms or even exaggerate our symptoms. I remember some doctor's appointments, I would purposely rub my eyeliner all over my eyes so it looked like I had bags under them. Or even if I had the energy to shower before a doctor's appointment, I wouldn't because I wanted to look tired and I wanted my hair to look messy so I could present myself as if I looked as bad as I felt on the inside. Which doesn't feel good to have to think that way, but we do, and it's exhausting. And then the last psychosocial impact I want to talk about, even though there's many and I can go on and on, but the expectations placed on women. So most often, not always, but most often women are the main caregivers in the household. They take care of the kids, cook, clean, carpool, laundry. So they have two roles. They're the patient because they're sick and they have to treat themselves and go through Lyme treatment. And then they're the caregivers. And you can't do both roles 100%. It's impossible. So the mom guilt kicks in. I feel so guilty I can't play with my kids at the playground. I feel so guilty I can't, be that PTA mom or volunteer more. And then the patient guilt kicks in. I should be detoxing more. I should have went to the sauna today. I forgot to take my meds. And no one understands that dilemma of having those two roles and having to be good at both. And that just further isolates them. Did I miss anything? I know I just shot out a lot of information.
No, that was great. It's gets back to the psychosocial dynamics of caregivers and close family and friends, and the impact it has on them and their relationships, and the isolation can be overwhelming. We did a previous live stream a few times ago that talked about that exactly. And I saw the same thing with HIV/AIDS in terms of separation, isolation, abandonment of parents of a gay son, happened to be gay, but had HIV, etc. So it was shocking. And I think that's another reason why physicians need to be more empathetic, because in all honesty, sometimes you're the one or one of two or one of few who the patient trusts and where they get hope. And they understand that you care. And if you don't care, you should try plumbing or something.
And if a doctor is also telling you that your symptoms are psychosomatic, or it's all in your head, and your family members are present, or friends, or whoever your support person is, I think it's natural that they believe the doctors, or they question, is that right? Or even worse, the patient believes that themselves, and they start thinking, am I going crazy? It's a terrible feeling, being in so much pain and knowing that something is seriously wrong and being told that it's all in your head. So that's probably, the biggest problem, psychosocial problem I hear about. All right, moving on. I've struggled with miscarriages and infertility. Can this be related to Lyme?
Yes. So, folks will come in and criticize us for saying, well, you think everything's related to Lyme. Well, if you guess that it is, you're going to be right much more than you're wrong. We're constantly hearing new associations that are reinforced, and that makes some sense. We're constantly learning about the complexity of the body. And that's a warning to the consumer. If you happen to go somewhere where they say they treat Lyme and they treat fatigue and they treat libido and they treat 15 other things, but included in that is Lyme, well, I would run the other way because it's not a simple illness. It's very complex. Not to say that some of the people can't help in some ways by reinforcing low inflammatory lifestyle. So here's a situation where we know that there are more miscarriages. We take our histories, but we've never done the counts. It wouldn't be hard in a year to do a prospective study of our patients and talk about their pregnancy history and how many miscarriages they may have had. I guarantee you it's far greater than the reported amount in or average in the population. So I would say yes. It's very difficult because you have hormone imbalance. You may not be able to set up the placenta properly. The endometrial environment may not be suitable because the hormones, the corpus luteum and so forth, are not releasing properly because there's so much disarray. So infertility, as I said before, some people just don't cycle, they don't ovulate. Some people have vulvodynia. It's too painful to have sex. They have cramps, all month long. It's too painful. So 100% the incidence. Now, if we had a research person, we could crank out a paper on this and numerous other topics in short order. So the answer is yes. And the other part of the question was infertility, which I think I answered. Some of our ladies have harvested eggs because in some cases there may be a problem with a partner having infertility or low motility in the sperm. And in some cases, lady decides, I just can't carry a baby, it's too difficult, and they have surrogate mother. But we work with the infertility doctors, and that ends up being the case, particularly if the lady is a bit older and frustrated that they don't have a child. They'll go that route. Hopefully, after we've treated them and they've been in remission for a year or two.
My marriage is starting to become severely affected. How can I get my partner to better understand Lyme and what I'm going through? This is a really great question. The harsh reality is no one will understand what you're going through besides yourself, but people can learn, or they can try to learn about it. I don't typically work with couples, but occasionally I will have my patients bring their partners into session, and I start with a really simple question of, can you explain to your partner what it's like living with a chronic illness? And I don't mean explaining the exhaustion of having endless doctor's appointments, taking 50 pills a day. I mean, explaining to your partner on an emotional level what it's like living in an unpredictable reality, going to bed and not knowing what tomorrow is going to look like, not knowing what the next hour is going to look like, not being able to plan your day or make any plans because you'll most likely have to cancel. If you have to take a shower, maybe that means you have to rest for 3 hours to recover. Or if you go to lunch with a friend, that might mean 3 days in bed. Having to plan our days so precisely is exhausting. And a lot of times couples talk to each other about the physical pain. I don't feel well, my head hurts, my stomach hurts, I don't want to go do this. They don't speak on an emotional level. And I think empathy, people are a lot more empathetic when we speak that way and not just focus on the physical symptoms. And a couples counselor can help with that too. And they can help with rebalancing the communication. Because if you're always talking about the illness, that's a problem. But if you never talk about it either, that's a problem too. So finding that middle ground is really, really important. And educating your partner. Knowledge is key. Education is key. So having them read books, articles, going to doctor's appointments with you. Oh, that's a big one. For a while, I didn't want my husband coming with me to my doctor's appointments because I didn't want our whole relationship to be about Lyme. I didn't want to burden him. I just wanted to focus on other things the time that we did spend together. But what message was that sending him? That I didn't want him involved in this journey, which wasn't the case at all. Your partner needs to hear the doctor talk about this. Your partner needs to see the doctor examine you. Education and knowledge is key to understanding. But it's a two-way street. You have to be willing to include your partner in this journey. You have to be willing to be emotionally vulnerable and express yourself. And they have to be willing to learn and to listen, not just out of obligation. They really have to have a desire to understand. You have anything to add?
Well, yeah, that was, as usual, excellent. Some of the partners become tone deaf because they're just overwhelmed and they don't understand, and they're getting input through experiences with other physicians who denigrate and dismiss the ill partner's complaints because they don't understand them. And there's so many of them. And typically in our system, if you're an HMO, for example, you get 15 minutes to talk about 20 symptoms. And so doctors typically will say, or often say, they either ignore you or they'll say, you can tell me about one thing today. Well, that just doesn't work. Here's what happens in a lot of our visits. We always encourage a partner to come. So whether it's a parent or a sibling or a husband or wife or a good friend, what have you, we encourage someone to come. And as we go, and they hear the interview, they hear all the questions, and they hear the responses, and they see the exam, and they see the summary. And a lot of times, the person who accompanied the patient will say, "Oh, that sounds a lot like some of the stuff I got," And maybe if they have a family and it's a spouse, they'll say, "Oh, I wonder if our 15-year-old is sick because she's had unexplained joint pain and hasn't had menstruation yet, and she's just moody and snappy and has ADD and all of that, and I wonder about that." And so we really attempt to do our interviews in a caring and thorough way. We don't judge anybody that's with the patient, but again, more often than not, they'll volunteer, "Hey, maybe I should come in because I've got some of this stuff going on." But let's say, for example, my wife, Louise, she's much sicker. Let's get her better, and maybe I'll come in later. Things like that. So it's an awareness that they haven't had. A lot of times they've been to. It's not unusual to be to numerous doctors. Everybody knows that. I call it the doctor trail. And they've been to numerous doctors. Some try to help, most don't. And the problem is it's compartmentalized so that you go to all these specialists and they do what they do. It's like the blind men, grabbing part of the elephant and figuring that, I've got the head where they got the tail, and I've got the trunk where they got the tusk or whatever. It's very good and reassuring if they're still open at that time. But having been hardened by months and sometimes years, it's not unusual to go decades with this stuff, where careers are aborted, marriages are threatened, and but they happen to be there. If they're a little bit open and they're listening, and there's a little bit of care left and love left, then they can say, hey, that was refreshing. Yeah, gosh, they made sense about some of these symptoms that you have that nobody else has made sense of, and they're real. And so, if it's there, if there's a glimmer of opening for the spouse or the partner, they may either say, hey, I may have this issue, or hey, I now want to help you. It seems like we have a path to recovery.
A great question just came through, and that is, can excessive weight gain be related to Lyme?
Yes. So, well, we noticed this many years ago. In fact, I lectured on it in London on metabolic changes in chronic inflammatory disease. There's no question that the breakdown of fat, which is called lipolysis, is inhibited. There's a hormone called leptin, which is its function is to break down fat when it's needed, and our folks became leptin resistant, so that it's harder and harder for them to break down fat through other hormonal and biochemical changes that are occurring, including insulin resistance, vitamin D changes, both in the fat and in the brain. In the fat cells, just being heavy promotes inflammation. I don't know if you knew that. And then, of course, the brain, the glial cells are acting badly and misbehaving and sending inappropriate signals. So, yes, I call it an inflammatory wedge. If you look at the hands of the clock, it's something like if you're supposed to be at noon, the hands should be straight up. And they wiggle all day long because we're creating toxins. I'm creating waste as I sit here, just breathing, talking, fidgeting, whatever. But we have plenty of glutathione in our liver, and we have other antioxidants that neutralize the oxygen radicals that we all make. Our brain is a metabolic organ which produces waste as well. Every organ produces waste, and it has to be neutralized. And in the normal bioatmosphere, everything's fine. However, if you have a chronic inflammatory situation, it's a new game. And so that pushes the needle over to 11, and people compensate by changing their diet, by sweating and exercising when they can, if they can, and they may get an extra hour of sleep, they may start to meditate, they may take some extra nutraceutical. People are desperate to feel better. And in doing so, if you're not too sick, you can neutralize or get back to 12, but you have to do all these other things. And then sometimes when the inflammation peaks up, not sometimes, most of the time, at some point all these things don't help. It's just there's too much. And so you get into an inflammatory wedge. Now you're sick. Now you're in constant inflammatory state. You're somewhere between 9 o'clock and 11 o'clock. And you stay there. And if you stay there, all these other metabolic derangements happen, including resistance to lipolysis. The fat cells can't be broken down. You know why? Because our body, we've inherited this from our ancestors. Our body thinks we're dying. And so they want to preserve all the fat stores that they possibly can. I think of a caveman with a spear in their side who, is struggling for life and is not going to break down fat because they're injured and they're stressed. And so there's nothing on this planet that causes more chronic inflammation for such a long period than Lyme Borreliosis Complex. There is nothing to compare to it. And there are a lot of questions about, okay, where did it come from? Why is it happening now? And, that's a subject for another discussion. But it's real, and it's out there affecting millions and millions of people. COVID being a trigger for activation of a lot of these things. We have another stressor now, which is called COVID. But there are many other life stressors, as Jules has alluded to, other infections, personal stressors, traumatic injuries, surgeries, childbirth, and so forth. But I call it the inflammatory wedge. I do the visual with the patient. I like to use my hands. I say, okay, over here, and then here's 9/11 over here, or this way, I guess. So if you're in the inflammatory wedge, you're stuck. You're going to gain weight even though you're not consuming excessive bad calories, which most people don't. They're frustrated. I have to get new clothes. And why am I gaining weight? I'm so sick, I don't overeat. This is so common, very common. There's also capillary edema and peripheral edema through interstitial edema accumulation through leaky capillaries in the periphery. So you can gain several pounds of weight just because your blood vessels are starting to leak and you're starting to get edema in the lower extremities. Now, I used to call this phenomenon of weight gain years ago. I used to call it the fat wedge, and I stopped it. I did that for a while, but people started throwing things at me, and it hurt. So I changed the name, and I call it inflammatory wedge now.
That's better.
It's better, yeah.
Yeah, I had gained a lot of weight prior to knowing I had Lyme disease, like 20, 25 pounds. It didn't make any sense to me. I was barely eating. And when I started Lyme treatment, almost immediately, actually, I know that's not the case for everyone, but almost immediately the weight came off. But it's so hard because you're already in so much pain. You don't feel like yourself emotionally, and now physically you don't look like yourself. So that's a tough one, especially for women, well, and men too. But
yeah, because on top of everything else, now they have dysmorphia, and they don't like they're horrified by how they look. They think I look hideous. I don't go out. I don't want anybody to see me. And it's just one more thing. This disease. One more thing. This disease piles on. It just continues to pile on. And if I can explain that, or one of my colleagues, Kim, Rachel, Candy, Sonia, Carrie, if we can explain that to the patient, reassure the patient, say, okay, you may get even bigger. It's not your fault.
You said that to me at first appointment. I was so upset about my weight gain. You're like, it's going to get worse probably.
Like, well.
Like, no.
Yeah, exactly. It's horrifying, but knowledge is power, and if we gained your trust, then it is what it is, and we have we'll work through it. Our job is to get the infections out in an intelligent way, in a safe way, in a proper way, and we can do that in most cases. Look, if we can't do it, we'll tell you, or if there are roadblocks. Now, we have about 30 roadblocks that I haven't published, and these are conditions that preclude therapy or complicate therapy. And some of these are some of the stuff we've mentioned already. The premenstrual volatility is a big one. And this let's talk about that for a second. This is easily the most common hormonal issue in women, the second being low testosterone. And what happens is that we have a hormone or a biologic called prostaglandins, which come from arachidotic acid, and they're cleaved by COX inhibitors, so they create prostaglandins of several types. There are 4 types. They're predominantly pro-inflammatory, and their jobs do various things to include make the uterus contract. But they also go outside the uterus. They're generated from the uterus, I believe. And they start working on that a few days before the cycle. And so as the estrogen dips, so as you know, estrogen rises and peaks and then starts to drift off unless you're fertilized. As the estrogen dips, you're losing your anti-infective or anti-inflammatory protective effect. Prostaglandins come up, and now you're inflamed. And if you're inflamed for a day before the cycle, that's very inconvenient and difficult. But I'm going to talk about ways to manage that. If you're inflamed for a whole week or longer before the cycle, in other words, you are a vulnerable landscape. There's a disproportionate amount of pain and suffering that you experience because you've been damaged by Lyme Borreliosis through all the neural channels, the brain. All those areas are sensitized. They're not normal, and so they're more likely to fire off or shut down. They do something bad, one of the two. So you get a pro-inflammatory storm before the cycle. Life is not easy. All your symptoms come up. And then when you start to menstruate, usually within a day or two, things will settle down. But now you've wasted 7 or 8 days of the month, and if you're cycling every 28 days, I can't treat you. That's too much turbulence. And so we have to manage that. And one way to manage that is if there are no contraindications, such as history of clots and so forth, our family history of estrogen-sensitive cancers, breast, uterus, ovary, then I'll work with a GYN and recommend some birth control, continuous birth control, which either means 90 days or continuous. That way you only have the menstrual turbulence every 90 days or not at all. And so that's definitely an option. Another option is Mirena IUD. And these are all age and family specific and social specific. What's the best choice? And I leave it up to the OB. I just think that's one area that we don't need to be dictating. We work with the OB and they're very good. And then, so if you don't want to do birth control, and let's say that what we can do is we can use anti-inflammatories. So we go up on fish oil, a good quality fish oil, such as Kirkland or Pure Naturals, and we'll take it, depending on body size, we'll take 1 or 2 grams twice a day. And since COX inhibitors, break down the conversion of arachidonic acid to prostaglandins, we may use a little bit of Advil. But that if there's no contraindication, no history of bleeding, no history of GI intolerance and so forth. I don't like to use these a lot, but they do help. You take it with food. You take, based on your body size, 2 to 4 of the over-the-counter tablets with food once a day, maybe, and that may help. So that would be a way to modify the intensity of the premenstrual turbulence and inflammatory process.
So we get a lot of families here at the clinic that are all infected, parents, the children. So a common question we get is, who do you treat first?
Boy, this is a good question. So our pediatric nurse practitioner, Candace Willett, when she sees a pediatric patient, she's really treating 3 people. And that's when a lot of times the mother will have an awareness that, our father, maybe I'm sick too, and so forth, because I have some of these symptoms and we just don't talk about it. If the mother, in a situation where, and this is very common, we have whole families, probably 250 families where 1 or more parents are infected, 1 or more children are infected. Is there a connection? Hell yeah. We talk about vertical transmission, and congenital Lyme doesn't have to, come in with deformities and tracheal dysplasia and reflux and, some of the common neonatal things. And remember, we, on a couple previous live streams, did put out our age-adjusted stratified incidence of symptoms for prepubescent and post-pubescent children, ages 0 through, I think, 20. So we have that information. I don't know if it's on our website, but it's been out a couple of times. Very helpful for parents to know what are the warning signals. I would say, and I don't know if Jules would agree, I think we treat mom first. Sometimes, but mostly mom, because she's a mom and she has a maternal instinct, wants her children treated. And it takes a few months, and if the child is stable, we can stabilize most children in a few weeks. So that's a big thing. And as the child gets better and the mom's compliant, she gets rewarded, and I think she gets uplifted, and some of her endorphins increase, I would hope. She may already be a patient, but we're just treading water with her for the time being. But seeing her children, because there's that maternal bond that is probably the strongest bond on the planet, we have a talk about it. We always talk about it, and mom makes the decision. So we always leave it to mom, actually. And so mom says, no, I want to treat the children, and this one first and this one next. And so what we can do for you is we'll just do a suppressive program, or just teach you about a low inflammatory lifestyle, how to do detox, and change your diet, change your sleep patterns, change your activity level a little bit, look at a supplement package. And we're going to tread water with you for a while, and your children are going to be starting to get better in several months.
Most moms, not all, but most want and will put their child's needs before their own. And it's also a huge stress reliever knowing your child is getting treatment. Not treatment in 6 months, not treatment in a year, but treatment right now. That's a burden lifted off to them, which will help with their symptoms as well. But as Dr. J said, if the mom wants the children being treated first, then stabilization, symptom management is usually what they'll do for the parent. All right, we have time for probably 1 or 2 more. So can endometriosis and other gynecological issues be related to Lyme? So endometriosis was actually my first real diagnosis I got when I was about 17. I started experiencing pretty severe lower abdominal pain, and after a lot of tests, and blood work and stuff, the OB decided to do exploratory surgery and found that I had endometriosis all over my uterus and both my ovaries. And the surgery helped with the symptoms for about a year until it came back. And then I did another surgery, symptoms returned. Another surgery, symptoms returned. So finally I was like, I'm done with this. I'm not continuing to have surgery for just temporary relief. And it really wasn't until I was diagnosed with Lyme several years later and completed Lyme treatment that my endometriosis symptoms stabilized. And I don't have that lower abdominal pain anymore. And I don't think I've had an ovarian cyst that I know of in several years. But I know Dr. J talks about severe endometriosis as a roadblock for a lot of his patients. So I'd love to hear more about that.
Yeah. This was added recently. By that I mean the last year or year and a half, as I realized there's enough people that have this that it becomes a roadblock. Sort of like the gallbladder. If you have an inflamed tissue, it needs to come out. And we know, and I've presented with Dr. Trad at the International Annual Surgery meeting in Las Vegas in September. And I divert, but acalculous, no stones, cholecystitis seen with Lyme. And it's all about chronic inflammation. So if we have tissue that's chronically inflamed and it's not essential, we take it out. Gallbladder comes out. There are a number of centers and a growing number of specialists who specialize in endometrial surgery. I think I must have 10 or 12 ladies, and they went through a procedure. It's a painstaking procedure. It's several hours of surgery. But if you have severe endometriosis, it's a game changer if they're successful. And as I said, you need to find someone who has expertise in this. And the number is growing. It's being driven by the market. You know, there's more ladies that have severe endometriosis. Are the implants infected? You know, I've never had anything tested. I should start doing that. I do know that we found the spirochete in a uterus in a myoma some years ago. So the spirochete goes everywhere. And here's the thing: if the endometrial implants are removed and they feel better, I think it's much more of an infection influence than a hormonal influence, because the patients feel so much better. They're not well, but it's a game changer. So you've taken out a ton of infected tissue. It's a tedious, difficult surgery. And I'm not just saying go to a specialist and go to have a 6-hour surgery. I'm not saying that. I'm just saying when severe, it can be life-altering, and it makes it very difficult for us to have a successful treatment course for you.
Last and final question is, how can I cope with postpartum depression while also struggling with Lyme? So, being 7 months postpartum myself, I will tell you it is really difficult. You will be more sleep deprived than ever, and you need support. It takes an absolute village. So, if you have a supportive partner, if they can do shifts in the middle of the night so you can get those longer stretches of sleep. As we all know, sleep deprivation and stress are known Lyme triggers, so managing those triggers as best you can. Can you get family and friends to come over for a few hours during the day and watch baby while you take a nap? And proper nutrition. It is so easy to forget to feed yourself or eat healthy when you're so focused on caring for this new little infant. So if family and friends can set up a meal train for you, or can you get your groceries delivered, or a meal delivery service, or if people say, how can I help you? Ask for Uber Eats gift certificates. Just any help with getting food delivered and eating properly is so important. And then getting out of the house. Postpartum is very strange in the sense that the minutes go by so slow and so fast all at the same time. All of a sudden it's 8 o'clock at night and you haven't left your house once. Like, how is this possible? So even if you can walk just one block, get out and do it. Take a drive. If you can't drive, ask your partner, family, or friend to drive around the neighborhood. And set one goal per day. Some days I even just said, I'm going to shower today. That's my entire goal. And it made me feel better. But we just become so focused on this new little baby, as we should, but we forget to take care of ourselves. And the social support, absolutely huge. I remember texting a friend who had just had a baby recently too. I'm like, are you getting these intrusive thoughts and images about like something horrible happening to your baby, which is very common in the postpartum period. She's like, yes, oh my God, I was so ashamed to admit that out loud. And just hearing someone else going through something similar was life-changing for me. You can feel really isolated. You feel like you're the only person going through this extremely difficult time, and that's not true. There's support out there. And if you're past the 2-3 week mark postpartum and you're still experiencing those baby blues and tearfulness, excessive worry, the intrusive images and thoughts, as I just mentioned, insomnia, seek out a therapist that specializes in postpartum depression or maternal mental health, and they can direct you on next best steps. Keep your OB follow-up appointments. Don't skip them, and be honest with them. I was very tempted as I filled out my little postpartum questionnaire to just say, yep, I'm good. I have no postpartum anxiety. What good would that have done? You need to be honest, and follow up with your Lyme doctor as soon as you can. If you're breastfeeding, as we talked about earlier, there's safe antibiotics you can take that won't impact your breast milk. And as I mentioned before, ask for help. This is such a difficult and isolating time, and we need that support. And what are your thoughts on antidepressants if the postpartum anxiety and depression is not getting better?
So I work with the OB. I mean, I'm not going to give anything that's not allowed, but they do allow SSRIs occasionally. But the main focus would be lifestyle improvement. It requires the support. Everything Jules said is just absolutely precious, because she's going through it. I'm not. I'm a little bit out of context here, but I do see issues like this, but I have to work with the OB, especially if they're nursing. Mm-hmm. I don't give anything without their approval. That's just not a good idea. And but the physiologic changes that have happened and the cognitive changes that have happened. Now you have a small person. You have all this responsibility. You're sleep deprived, which is so important. And if our patient hasn't been in a great healing stage, like Jules was not totally healed. She's going to take another few years to heal, but God bless her. She's remarkable, but she's the exception, folks. So I'll use a low dose SSRI, something like Celexa or Citalopram, if the OB is okay with it. Now, the female has lost, the mom has lost her protective estrogen. It's way down, and she's been through the stress of childbirth, and she may have support issues, and her poor brain is just, some of the receptors are gone, some of the neurotransmitters are not functioning very well, and she needs support. So there's this huge, in fact, we see the onset of Lyme Borreliosis after one or more pregnancies, and that was the onset of symptoms in a lot of patients who all of a sudden develop pain or weakness in an extremity, or have headaches they haven't had before, things like that. So that's a trigger. It's an actual trigger. So why not have depression with that? And by the way, the shower's a great idea. So I shower once a month, whether I need to or not. No, just kidding. But those are great ideas. Some, just a few minutes of yoga or meditation, or just something you can feel good about. Always try to accentuate the positive. I think that's so important.
Well, we are about out of time, so I just want to thank everyone for tuning in. And again, thank you for sending your great questions. If you guys have any ideas for topics for future live streams, send them in. We love your input, and thank you so much for watching, as always.
I'd like to thank my partner, Julsey Capon, lovely lady, and so happy for her, and so thrilled that she's willing to work with us. And I want to also thank our filmographer, Yusuf, who's been with us for all 18, and Laura, who is our filmographer as well. We have a wonderful, wonderful team, so I'm very thankful for that. And I really appreciate that you're interested in what we have to say, because it's about education, demystification, and validation. God bless.